Good afternoon, ladies and gentlemen. We're into our final push of day 2. We've got a couple more panel discussions lined up for you and a very special presentation coming up as well. Now, first of all, here we're going to be talking about biotech and women's health. May I please invite back on stage my co-host, Dr. Fatima of M42.
Thank you so much.
Dr. Fatima, we have a cast of thousands for you yet again. I see that you're holding some books, so first of all, maybe you want to explain the books that you have?
Absolutely. I have Dr. Louise on board today. Again, I have some gifts, and mainly I have Dr. Louise and an amazing team. I hope that you will be enjoying the session with us. It's about women's health or health women. Let's see together if, in fact, which one of them we're going to tackle today.
I love that. And I think maybe you're going to ask the audience to tackle some questions in order to give some books away as well. So is that right? There's going to be some
questions.
Fabulous.
Absolutely.
Do pay attention. Now, Dr. Fatima, allow us to introduce your wonderful cast list for this panel. I'm going to begin with our token male. We don't want him to feel left out. Robert Adam Griffiths, a Senior Director of Clinical Operations at M42. Please do join us. Please don't feel outnumbered.
Welcome on board.
Very well humoured. Dr. Fatima, if you'd like to.
Yeah, I would like to welcome Dr. Neha Gami, Consultant Obstetric and Gynecology in Health Plus Family Clinic and initiator of Wellness Clinic, our Leha.
Dr. Samina Ahmed, the Medical Director, Consultant, Family Medicine Health Plus Family Clinic. Thank you for joining us.
I'm more than happy again to welcome on stage Dr. Louise Newsom, please.
Physician and menopause specialist and Newson Health founder. We will be hearing a special presentation from her, and she's here with the Longevity Forum. And then our last but not least, Donna Howarth, the founder of Middle East Menopause Organization. Thank you so much. And on this note, I depart the stage. Dr. Fatima, the stage is yours.
Thank you so much. Kindly. I'm extremely honored and happy to have you on board. And I'm also extremely happy and honored to have all of you on board. Thank you for waiting with us, for this amazing panel. Thanks a lot. Prepare your questions. There's 3 books. How do you feel, Adam?
Nervous.
You can gain, there is books, you know what? You're the only man with us today. We're going to tackle women's health or health woman?
Women's health.
Okay, let's see then. Then as a leader, you are the Director of Clinical Operation of Primary Care. Tell us some of the initiatives you're having and potentially any future, what are you planning from a biotech point of view?
Okay, so I'm not going to steal Dr. Neha's thunder, so I'm certainly not going to touch on Laha too much. What I would say is, and I will tell you, on the very first day, my wife was one of the patients and is already making significant steps forward with her health and the way in which it's changed her, which for me has been amazing. So thank you very much. More sleep at night, less aircon, it's fantastic. So a big step forward, and it's amazing. So I can tell you from first-hand experience, certainly from my beautiful wife, it's been very, very helpful.
Very good. Doctor,
what are we doing
let me ask Dr. Neha here, In our KPI, we are measuring patient experience happiness. Are we measuring husband experience as well? Looks interesting.
It would be really interesting, especially for patients who come to LAHA for perimenopause and menopause, to actually see the impact on the family, the children, especially teenage children. So when there's a teenage child in the house and a perimenopausal mom, there's a lot of hormones going on in the house, and really it improves the quality of life for the whole family. So it's important that we encourage our women from that perspective as well to reach out and take help for it.
Amazing. I was one of your patients also, and I went through the whole questionnaire. The next time, potentially, we'll have some men in your clinic. Let's see. That's a good angle. Then Adam. Accept the fact that you are a happy man and a happy husband now, Tell us about biotech and women's health.
Okay, so very, very similar to how I touched on the last presentation. But we're trying to be at the forefront of biotech. So what we're trying to say is, how do we look at patients from a demographic, from an age, from a established condition such as menopause or other conditions, how do we as primary healthcare providers look at that group as a cohort whilst being cognizant of their history, their medical history, social history, and make sure we deliver the best to each individual based on group dynamics? So that's genome, maybe using other parameters, including AI, to best plan individualized care while being cognizant of the wider social group and social network around that. So
That's amazing. Let's see, in fact, what we are going to achieve in the next years. This is an amazing project. Thank you so much on behalf of the 47 million of women who reach menopause yearly. I've taken this number from Louis' presentation. Thank you. Then let's go to Dr. Neha. Dr. Neha, please, tell us more about the Laha Clinic. Okay.
So first of all, I just want to thank the management of M42 for giving us the opportunity to launch Laha Wellness Hub, which means for her. And it's actually for her because, like you said, 47 million women will reach perimenopause and menopause every year. That's going to be 50% of the world's population in a few years, of women population. So we're looking at a large number, and we're looking at women who are struggling through it silently. And that's where Laha steps in, because we are there to listen. We are there to individualize based on all the models and all the knowledge that we have. And then we're there to offer a personalized plan of care to these women as they go through their journey. Some might just need a listening ear. Some might need a shoulder to cry on. Some might need herbs, medicines, vitamins. Some might need hormone replacement. So it depends on where that lady is on her journey, and there will be a personalized, holistic plan of care for her. So that's what Laha aims to do, and that's what we're trying to do.
That's amazing. Then M42 is where innovation is meeting healthcare. Okay. Can you tell us where innovation is meeting women's health?
So, especially with menopause or with reproductive endocrinology, biotechnology and innovation has done a played a huge role because, we started from a point where we were giving equine estrogen from pregnant mares to women, and then from there to reach body-identical and bio-identical hormones. That's a huge leap in maybe, 40 years? 1960, we were giving equine estrogen. And in 40, 60 years, we are back where we are. So technology has really helped us. And where M42 is concerned, the innovations that we are doing, the kind of models that we are trying to build for based on patients' history, based on their genetic makeups, we're doing microbiome studies for these women. So we are helping. There's a whole link between microbiome and menopause now. Because of the estrogen recirculation. So there's a lot of my patients who now go for microbiome testing, and then they come back and then we work on that. So that's where innovation comes in. We use lifestyle medicine. We use other parameters and diagnostics to help them reach the best health that they can achieve.
That's amazing. Thank you so much. The question about women's health and health women, okay, for you, it applies as health women? Gynecology?
That's
Gynecology?
the aim. So women's health will improve when we have healthy women.
Okay. As a gynecologist, okay, this is a specialty for women, isn't it? Let's see with Dr. Samina, who is the medical director of primary care, and I think that the Laha is based on gynecology and primary care. What's her approach to women's health as well? How are you supporting, and what's the idea, behind this approach, Dr. Samina?
Yeah, Dr. Fatma, before we get into that, I just want to point out to the audience, and I think generally speaking, women are the biggest proportion what we see in primary care. Not necessarily as patients, though. They'll come in bringing their child. They'll come in holding their spouse's hand. They will come in with themselves or with a sister or the family member. And that's what we try to encompass in primary care. So the woman as a whole, holistically, her mental health, her physical health, and what we encourage is that women seek help from themselves, not only just for family members. And I think that's what, and I don't want to sound sexist here on this panel today. Adam's the only male here, so I don't want to sound sexist, but women generally tend to put themselves in the background. They will try to put others forward. They look after their parents, they look after their children, they look after their hubby, spouses, but seldom do they come for themselves. So I think one of the initiatives which the Laha was that women need to look after themselves. They're important for the family. They're important to keep the family together as well. So if they are well, the family stays well. I think that's one of the things that we look in primary care, that we make sure that we look after the woman as a whole, and particularly through different stages of her life, especially menopause, which since we are speaking about women's health here, and otherwise as well. So once she is well, the family tends to stay well as well.
That's amazing. Then I'm going to ask you, as also one of the leader and one of the, let's say, the guru of primary care, how are you going to integrate innovation? Because again, okay, the future is here. Okay, what's your initiatives on innovation within the primary care and especially within the LAHA initiative?
Yeah, so I mean, digital health technology and biotech solutions have caused a lot of innovations in healthcare. And in particular in primary care, it's manifold. If you start with simpler things, telemedicine is one. So telemedicine provides remote patient care. So it makes sure that in the UAE, you may be in areas where you may not have access, for example, to attend the LAHA clinic. You can have digital consultations with them, telephonic consultation with them. Dr. Neha, our family medicine doctors, our psychologists can all provide that care virtually as well. So that woman does not, so if she's living not in Abu Dhabi or Al Ain, she's living in a more further region, she will still have access to this service. So that's something which, which can be explored and looked into as well. Then we've got things like mobile apps. We're living now in we're talking about 6G, 7G. So patients, mobile apps is very easy. You go on your apps, you download the data, an app, and through wireless technology, you can diagnose conditions, menopause being one of them. If you put your symptoms into a symptom checker, you can provide your information, early detection, and then early help as well. So things like these obviously, are providing, and the other things on, for example, genome testing. We talk about clinical genomics. So testing for clinical genes, for women's health, that provides another, sort of promising digital biotech solution for the women as well. So it's manifold in primary care. There are a lot of challenges as well. I mean, there are opportunities as well. But then, of course, there are a few challenges as well to, women's health as well.
Thank you. It's great that you are speaking about the app. M42 app is on board, and I know that our team is customizing, a special area for women's health. But having Dr. Louise on us, with us, it's amazing that everyone, I think, is aware about balance with the free app. Dr. Louise, I'm very, very proud to have you on board today, and thank you for answering in very short time and coming with us today. As you've seen, M42 is having a newly implemented initiative. Tell us more, for your long path, how you implemented it. What is your recommendation to your team? And from a biotech point of view, what do you recommend? How can we take from your experience and move forward for our experience as well?
Well, it's so important, isn't it? Because we've already said that menopause affects 51% of the population. But
I get the number.
Yeah. But in fact, it affects 49% indirectly, as we heard. But it's not just menopause. We don't want to be waiting for the menopause, because actually so many women we see are really struggling with symptoms. They're struggling with their mood, their memory, their concentration. They're giving up to work. We've heard from Andrew how longevity is so important. We want to keep women working. We want to keep being healthy so we can support our family and everything else as well. So technology is the only way to reach people. We have the largest menopause clinic in the world. We see 3,500 women a month, but that's nothing when we've got 47 million a year to address. Sure. So technology has been incredible. With Balance app, which we are determined to keep free, women can download the symptoms, they can make the diagnosis themselves, they can be given individualized information. I've got a huge amount of IP, so I know the information that they're given is evidence-based, it's up to date, it's personalized for them, and that really empowers them to have the knowledge and information, so whatever country they go to, wherever they see, they can actually get the right support and treatment, because that's the only thing, is the treatment that's going to improve their future health.
Thank you, Dr. Louise. The right support. Then who is better than our colleague, Donna, who is the founder of Middle East Menopause Organization, to tell us about the support that you are providing to ladies. And I take the opportunity to congratulate you for the International Coaching Week for this week.
Thank you very much. Thank you. And good afternoon, everybody. So the work that we do in the Middle East, put quite simply, is that we represent the voices of menopausal women. menopausal women
Donna?
now.
Can I ask you?
Sorry?
The mic, please.
Sorry,
We
I
want
do
to hear you.
apologise. Sorry, so Memo represents the voices of menopausal women now and future menopausal women as well. So we provide information, we provide guidance and direction to clinics such as the Laha Wellness Hub, and it is very much needed. Women in the Middle East need support clinics where they can gain 360-degree support of care from all angles, not just visiting or speaking to a consultant, speaking to a dietitian, speaking to a psychologist, and the list can go on. So primarily, we are here to support the women of the Middle East and future women.
Thank you so much. Can I ask you, Louise, okay, in your practice, okay, what is the part of the digital, okay, and biotech and digital in your kind practice?
So it reaches so many ways, actually. So the biggest way, I think, is being given information, but also the symptom questionnaire, actually. So we use a symptom questionnaire that is on our app. We use it in the clinic, so we monitor every single woman that comes. But, and I say but, the symptoms are 21 symptoms. It's a validated symptom questionnaire that was actually formulated in 1976 by a man who saw about 3 patients a week, I think. So we've just done actually a survey, the largest survey in the world, of nearly 6,000 perimenopausal and menopausal women. And the commonest symptoms are actually the ones I showed yesterday, affecting our brains. So we're trying to create a new validated symptom questionnaire that is a lot more comprehensive for women. And we can use, with technology, we can show we're involved with, we're funding a PhD student in AI and data manipulation. So we're looking at thousands of patients in our clinic and seeing how the symptoms improve with different hormones, because obviously we personalize the care, optimize the right dose, the right type of hormones. And some of the results we're seeing, which we're in the process of writing up, are phenomenal. And that's going to change, having huge numbers, using technology to actually show. But it's not just symptoms that it's improved, it's their future health, their inflammation, their reduction risk of all the diseases of aging, which is that's going to change the narrative for menopause going forwards.
Amazing that you spoke about longevity with our amazing team from the longevity also, colleagues. What's your approach as well, in your clinic for the longevity?
So it's so important that we think about menopause as a long-term hormone deficiency with health risks. We can't deny the fact that women who have low hormones have an increased risk of heart disease, osteoporosis, diabetes, dementia, and it has to be a holistic approach. There's no point me taking HRT and smoking 20 a day and eating processed foods and not exercising. But actually, as a physician, I'm very good at holistic care for my patients. But often, women are trying desperately to eat their way out of the menopause or exercise their way out of the menopause, and they're not going to replace their missing hormones, If someone had type 1 diabetes, we wouldn't manage them without insulin. So we have to think in a different way. We have to think, what are the risks of this woman not taking hormones? Optimize her hormones, and then lifestyle is so much easier to optimize as well.
Dr.
Can I
Neha,
just
please?
add? So this is exactly what I tell the patients here, is that when I put them on HRT, don't think of this as the solution of all your problems and that's it. Use this as a window of opportunity, because this is going to help you build your lean muscle mass. This is going to make you feel more energetic so that you can plan your exercise, you can plan your home-cooked meals, you can stop eating processed foods and work on all the other health things that you need to work on, because it is a holistic thing. It's not just one thing. But they need to use that as a window and utilize that new, renewed, energy and vigor that they've got to, build a better life for themselves. Because now women are almost going to live 50% of their lives without hormones. So 50% with hormones and almost 50% without. So it's a huge amount of time, and they need to prepare for it.
Thank you so much. Dr. Samila, what are the challenges you are facing?
I think the first challenge is the cost. So, when you have digital technologies, you've got state-of-the-art apps, you've got everything, you need to invest in it. So obviously, it's a consideration for any organization. You're putting in a lot of money into it, so that's the cost sometimes, steps the adoption of these measures. The second thing is cybersecurity. And I think that's everywhere. That's globally, whether it's with your bank cards, with anything. So I think with patient data, cybersecurity becomes a big issue. You have to invest in that as well to make sure the data stays confidential. The third aspect would be training. You need to make sure that with these sort of biotech, state-of-the-art solutions, your staff is trained. Because if your staff is not trained, then the results might not be accurate, and that would lead the consumer, the patient, losing confidence in that treatment, in that solution. And the lastly thing I think which I would add is ethics. So if you have artificial intelligence and you have do a surgery or whatever, a diagnosis, things don't go right, who is responsible? Is it the physician who's actually not maybe seen the patient, has gone on artificial intelligence and made a decision? Is it the manufacturer? Or is it the healthcare asset itself? Who takes the blame for if things go wrong? So I think these are some of the challenges, some of the things which we need to consider with biotech solutions.
It's extremely valid and it's extremely important to ask these questions because, again, this is a global, in fact, let's say, issue that you are tackling. And I'm sure that we can benefit from the experience from each other, like having Dr. Louise here, having our colleagues from Juvenesis, that we can speak together and find together answers. Then I'm coming back to you, Adam. As a visionary leadership, I'm sure you have already some plans to what Dr. Samina was speaking about, but also potentially you can speak to us about the partnership that you are able to have in order to have such initiative, a viable initiative.
Okay. Yes. Thank you. So let's go back a few hundred years maybe, and if we look at the innovation of corrective surgery for long bone fractures, and actually overnight, as we progressed through France into the UK and did surgery on what were quite simple fractures that people were dying from, we made a step change. Let's look into the 1950s where the explosion of antibiotic therapy started and people stopped dying of relatively simple illnesses and injuries. We come into the 70s, 80s, 90s where we did a lot more corrective surgery, started working on cancer therapies, chemotherapy. They were step changes in treatment. Look into the early 2000s where trauma surgery totally changed through as is often in the case in war, therapies change and they change at great pace. Trauma therapy changed hugely in the early 2000s. We are at the forefront now of the next big change. AI is the big change. We have to embrace it. We have to be cognizant of all of the things you touched on, ethics and everything else. But my job is to make sure we answer those questions to allow you to do your job as quickly and as efficiently as you can, because I'm sure 47 million is probably just the tip of the iceberg. It's probably significantly higher. For me, it's not just about women's health. It's how I use it for the whole continuum, all of patients. And that is somehow how I have to work with companies. I have to work with people like M42, or, my own M42 team and other biotech companies to make sure we do all of this stuff in the background to make their job as easy as possible to drive innovation. Because I'm quite sure we'll look back in 5 to 10 years and think what they did there was innovative. It kicked forward the next big revolution in therapy. And I'm really keen to be at the forefront of that, to make sure we as M42 and me as a healthcare provider, we give the best possible opportunity to all of our patients, whether that's through social, just that social revolution of this is the next big step. And I have to take our staff, our group on that journey with us. So, yeah, it's exciting.
You can have a longer wish list. He's a visionary leadership. Come back with the list. AI is here and is going to stay. Technology is here and is going to stay.
I mean, absolutely it is. And if I look back 10 years when I first really heard about it, I wasn't a believer, I was honest. I thought I was going to lose half my nursing workforce and half my physicians to be out of work. It's the total opposite. What we're doing is innovative and we're pushing physicians in a different way. Rather than numbers down, we're probably pushing up and we're using them in a different way. Same with the nursing team behind them, which drags everybody forward to allow us to deliver healthcare to our patients in a very different way. So.
Thank you so much, Robert. Adam, sorry. For the audience, do you have any question? It's a valuable panel that we are here. Please, any question?
Thank you. Good afternoon, everybody. I'd like to thank M42 for hosting this really interesting discussion, which is a very important topic. We've heard a lot about how we're using technology to contact and connect with patients who are perhaps already informed about the menopause. I'd just like to sort of ask, how does the panel think that we connect with women who perhaps are still unsure of their symptoms, worried about the stigma, scared about coming forwards? And how can we build on what is a momentous occasion here, as you say, the potential for a step change, to continue that conversation so that we make a real change for the women here in the UAE?
That's amazing. Let's ask Dr. Louise what she's doing and then ask our team what they are doing. Go ahead.
It's such an important question because we are really just reaching the tip of the iceberg, and I spend a lot of time worrying about women I'm not reaching. And in fact, it is a plug for the book, I suppose, but there is a chapter about women who are unseen and unheard. I do a lot of work in disadvantaged communities. I'm doing quite a lot of work in prisons at the minute, actually, and also women from ethnic minorities, women who can't speak English. You know, I'm a white, middle-class, educated doctor, and I cannot receive HRT from my own GP. They won't give it to me. So I know how hard it is for me. How difficult is it? We also know that in areas of deprivation, women are far less likely to be prescribed HRT, but they're more likely to have heart disease, clinical depression, diabetes, dementia. They're more likely to have antidepressants and everything else as well. So it's a massive, massive really important, but it's also important that people learn from like-minded people. There's no point me going in and trying to understand how it is for people, but actually having people who are like-minded. So we've done a lot of work, for example, with women living with HIV, and the information I've written is now being translated into 22 languages in Africa by women in those countries, and that's going to make the biggest effect. So doing that is really important. So involving the women who are suffering, and once women get it, I hate to tell the men in the audience, but we're not stupid. We work in quite mysterious ways as well.
Last innovation, we're not stupid, really, I like it.
But that's really important. You know, people that don't have mobile phones, who haven't got access to internet. That's why I have a lot of written information as well. Using the podcast is a really important vehicle, because this is a global problem. We have to acknowledge it. And so it's starting, but there's a lot more we've got to do, definitely.
Dr. Neha, any input in UAE?
That's one of the reasons, actually, when we started LAHA, and the age that we started including women for this clinic, for perimenopause and menopause, is actually 35. So we didn't wait for 40 or 45 to then talk to them about when they've already reached menopause. We want to talk to younger women so they have the opportunity to go for fertility preservation if that's what they need, if they want to do preventive care to prevent the symptoms of menopause. So we want to start talking to them early. And the second thing that will help is forums like this. When more and more doctors of different specialities start hearing about it, start talking about it. I had a referral from an orthopedic colleague from Health Point the other day. He has women with aching joints and pains all the time. And he said, I think she needs you. So, you know, when all of us start talking about it, the medical community is more aware. Each one will watch out for those symptoms. And even if it's a 29-year-old having those symptoms, she should be referred and she should be evaluated and given the right care. So we are getting there, and we are on the right path.
Thank you. Second question?
Can I just ask Robert a question? Bearing in mind that most healthcare systems historically have been designed by men for men, and research has been designed using male counterparts, how can you be sure that any AI that you design is going to appeal to women? And are you involving women in the design of your software?
Yes.
You're in trouble.
Yes, I am. I feel like I should face the wall.
I will provide some statistic after.
Yeah, maybe so. Yes, you're correct. Totally true. Male dominated. Even the industry itself is still male dominated. But I mean, I'd have to maybe impress more from our G42, M42 colleagues. Yes, women are involved in it. Yes, they're at the forefront of driving this. This is part of the reason I just came here to almost celebrate it. Really, is that You're totally correct, though, and my job is to make sure that those team members are there and they're there, and we give them the opportunity to help that to deliver. And I was just listening to what you're saying. It's almost a social movement we're trying to create, isn't it? It's not just about health. It's that whole social context behind it to make sure. I have an 11-year-old daughter who we're already talking to around, what does it mean in the future, and how does keeping her healthy now make a difference when she's 40, 50 and 60. So no, you're totally right, and we're very on board with that, not just personally but across the asset group and M42, and I take that argument and that discussion forward wherever I can. So
thank you for the question. Please go ahead, Joanna.
Hi everybody, and thank you to our esteemed panel. We're lucky enough to live here in Abu Dhabi in the Middle East, one of the safest cities in the world, if not the safest. However, there are many topics, and I would say menopause is one of them, that still remain a little bit taboo in this region. What can we do? How can we have all of these great experts put our heads together and really, help to bust some of these myths and break down some of these taboos in our region for the greater good?
Absolutely. Let me ask Donna, okay? That's, I think, one of the angles that she's tackling in UAE.
Thank you. That's a great question. I think the most important thing we can do to continue raising awareness is to open conversations like we're doing now. Because in talking more openly and more freely and destigmatizing, then we can help to normalize menopause. Menopause itself in the Arabic language is known as the age of despair, and that itself raises certain connotations and negativity surrounding menopause. But thankfully, due to an advertising campaign done by Tenor in Saudi Arabia, that has now been changed to age of renewal. And that's how it should be seen. It's a completely different life stage for women to look forward to. But before that, we have to keep opening these conversations and normalizing, and also recognizing the rich diversity that we have in Abu Dhabi and the UAE as a whole. We have upwards of 200 different nationalities, and each one of them has to be recognized if we are able to continue to open these conversations.
Thank you so much. To end our conversation, I'm inviting you, Louise, okay, to give the last word. What do you want to say to our tech health, guests around you? What's your message?
I just want to say thank you for listening, but I also think we need to reframe menopause, actually. We need to think about it, as I said yesterday, as a hormonal deficiency that affects every single person. Because if it's normalized, and I know what you're saying, but if it's normalized too much, then it's just accepted as normal, it's accepted as something we have to endure. So changing the conversation, embracing younger people. I've got 3 young, daughters. They need to understand. They need to be understanding what hormones are. It's a lot more acceptable to be talking about contraception, which are synthetic hormones, by the way, that block natural hormones. So we need to be starting thinking about our natural hormones and about the health risk associated. So until we reframe, we need to get rid of the word menopause, actually, and think more about hormones, and then it opens up different conversations.
Thank you so much. It's one of the global issues with 47 million on yearly basis, okay, with an amazing international expert. Thank you so much. Thank you. Thank you. Thank you so much. Thank you. Thank you so much. Let's have a picture together, please.
Fatima, really well done. We're going to have to wrap up, so a very quick book giveaway. Thank you so much. Please, can we take a photograph of our panelists? A wonderfully insightful panel. I feel like we are friends of all our panelists, so we were generous with the timing, which we needed to be because there was so much to discuss. Ladies and gentlemen, please give them a big round of applause. Thank you for your time and your wisdom. Thank you for sharing everything with us, Doctor. Thank you, Dr. Fatima. We're going to set the scene for the next session.